If your parents seem fine during the day, sharp enough, moving around, holding a conversation, you might think you have more time. More time before you need to worry, more time before things change. But here's what most families find out too late. The decline did not start when the fall happened, or when the memory slipped, or when the diagnosis came through. It started at night, in their bedroom, while everyone else was asleep and nobody was watching. Sleep in aging adults is one of the most powerful early warning systems the human body has, and most adult children have no idea what to look for because it does not look dramatic. It looks like tiredness. It looks like just getting older. Today, we are going to change that. I'm going to walk you through 6 sleep warning signs that research now links to cognitive decline, cardiovascular risk, fall risk, and early mortality in adults over 65. These are not vague things to worry about. These are specific, observable patterns you can watch for, starting tonight. Stay with me until sign 5, because that one surprises almost every family I have ever spoken with. It is the sign that looks the most harmless and turns out to be the most serious. Let's get into it. Sign 1. They are sleeping more but complaining they are tired. Most people assume that sleeping more means resting more. So when an aging parent starts sleeping 9, 10, even 11 hours and still wakes up exhausted, families often say, well, they're getting older, they need more rest. That assumption can cost years. Think about Dorothy and Helen, both 74, both retired, both living alone in their own homes. Dorothy started sleeping longer. Her daughter noticed she was napping in the morning and going to bed right after dinner. The family thought nothing of it. Helen's son noticed the same pattern and brought it up at her next doctor's visit. Dorothy was diagnosed with early-stage cognitive decline 18 months later, at a point when intervention options were narrowing. Helen's doctor identified a thyroid issue and early sleep apnea. She was treated. 2 years later, Helen is gardening and driving herself to appointments. Same sign, completely different outcomes. The difference was that one family knew it was a sign. Here's why this happens in the body. As we age, the brain's ability to cycle properly through deep sleep, what scientists call slow-wave sleep, begins to deteriorate. The hippocampus, which is the memory processing center of the brain, does most of its critical work during deep sleep. When that deep sleep is disrupted or absent, the brain does not fully restore itself overnight, so it signals for more sleep. But more light sleep doesn't fix the problem. The brain keeps asking for rest it never fully receives. This is not laziness. This is the brain sending a distress signal using the only language it has. The first step is simple. Track it. For 2 weeks, note when your parent goes to bed, when they wake up, and whether they still feel tired in the morning. If they're sleeping more than 9 hours regularly and still reporting fatigue, bring that log to their doctor. Don't just describe it, bring the written record. Doctors respond to data. Ask specifically about a sleep study and thyroid function testing. Both are commonly overlooked in seniors over 70. If your parent is recovering from illness, surgery, or on medications that cause sedation, this pattern may be expected and temporary. The key word to watch for is whether it's new and whether it's paired with daytime confusion or mood changes. That changes everything. Sign 2. They are waking up multiple times a night. Waking once or twice is normal. But if your parent is up 3, 4, 5 times a night, getting up to use the bathroom, feeling restless, watching TV at 2 a.m. because they simply can't sleep, that fragmented sleep pattern is doing serious damage that you cannot see on the outside. Consider Robert and Gerald, both 71, both dealing with frequent nighttime waking for over a year. Robert's family normalized it. Dad's always been a light sleeper. Gerald's family asked about it at their doctor's visit. Gerald was found to have moderate sleep apnea and early signs of nocturia related to an undetected prostate issue. Within 6 months of treatment, his nighttime waking dropped to once per night. His energy, mood, and balance all improved measurably. Robert, a year later, had his first significant fall. Here's what fragmented sleep actually does to an aging body.
Every time a person wakes up and falls back to sleep, they restart the sleep cycle. Deep restorative sleep, what scientists call slow-wave sleep, the stage where the immune system repairs tissue, where the brain flushes toxic waste proteins through the glymphatic system, where cortisol resets, that stage requires a sustained block of uninterrupted sleep to fully activate. Break the cycle repeatedly, and the body operates in a state of chronic partial recovery. Over time, this elevates inflammatory markers, weakens immune response, and dramatically increases fall risk due to impaired balance and slowed reaction time. There are practical things to investigate here. Is your parent getting up to use the bathroom more than twice a night? That may be a separate medical issue, bladder, prostate, or blood sugar worth addressing on its own. Is the room too warm or too bright? Light and temperature disruptions are major triggers in older adults because the brain's thermoregulation becomes less efficient with age. A sleep specialist can run a full assessment. This is covered under Medicare Part B when ordered by a physician. Some medications commonly prescribed to seniors, including certain blood pressure medications, diuretics, and antidepressants, are known to disrupt sleep architecture. If nighttime waking began after a medication change, make that connection explicit to their doctor. And if you're still watching this and finding it valuable, drop the number 2 in the comments right now. It tells us this topic is resonating, and it helps us reach more families who need this. And if you haven't yet subscribed, hit subscribe and the bell so you never miss a video like this one. Sign 4. Their breathing sounds different at night, or has stopped sounding like anything. This is the sign that's the easiest to witness and the most dangerous to ignore. You visit for the weekend, you hear your parents snoring, loudly, irregularly, and then silence, a pause, then a gasp or a sharp inhale, and it repeats all night. That is not snoring, that is sleep apnea. And in adults over 65, untreated sleep apnea is directly linked to atrial fibrillation, stroke, and accelerated dementia. Margaret and Elaine, both 68, both postmenopausal, both with the same loud, interrupted snoring pattern noticed by their families during holiday visits. Margaret's daughter assumed it was just age. Elaine's son recorded it on his phone and played it to her doctor at the next appointment. Elaine was diagnosed with severe obstructive sleep apnea and started CPAP therapy within 3 months. 4 years later, Margaret has had one transient ischemic attack, a warning stroke, and is on blood thinners. Elaine's cardiovascular markers have improved. Her cardiologist has told her the CPAP likely prevented a cardiac event. One recorded video on a phone, that's the difference. When breathing stops during sleep, oxygen saturation in the blood drops. The brain interprets this as a threat and triggers a stress response, releasing adrenaline, spiking blood pressure, and forcing the body to wake just enough to restart breathing. This can happen dozens or even hundreds of times per night without the person ever fully waking up or remembering it. Every oxygen drop stresses the cardiovascular system and the brain. Over time, this repeated stress damages the walls of blood vessels, increases arrhythmia risk, and accelerates the deterioration of white matter in the brain, the connective tissue responsible for processing speed and executive function. Record the breathing at night if you can, even a short clip. You don't need to do anything elaborate. A smartphone on a nightstand for 10 minutes is enough. Bring it to their doctor. Ask for a referral to a sleep specialist and request a home sleep apnea test. These are now available without an overnight clinic stay and are typically covered by Medicare when medically indicated. Not all snoring indicates sleep apnea, and not everyone with sleep apnea snores loudly. Some people, particularly women, present with quieter, subtler breathing disruptions. The key diagnostic markers are daytime sleepiness despite adequate sleep time, morning headaches, and witnessed breathing pauses.
Sign 4. They have become noticeably more irritable, anxious, or depressed, especially in the afternoon. You call your parents mid-afternoon, and they seem short with you, or sad, or just flat, like they have lost interest in things that used to excite them. You might think it is depression setting in. You might think it is grief, or loneliness, or just the weight of age. And it might be. But before any of those diagnoses are made, there is a question that almost never gets asked. How is their sleep? Think of Thomas and Victor, both 77, both widowed within the past 2 years, both showing increasing irritability and low mood by mid-afternoon. Thomas was referred directly to a psychiatrist and started on an antidepressant. Victor's primary care physician ran a sleep assessment first. Victor was found to have severely fragmented sleep with almost no REM sleep, the sleep stage where emotional memory is processed and emotional regulation is restored. He was treated for sleep apnea first. His mood symptoms resolved significantly without psychiatric medication. Thomas, a year later, remains on medication with mixed results. His sleep was never evaluated. REM sleep, rapid eye movement sleep, is not just the dreaming stage. It is the brain's emotional processing system. During REM, the brain reactivates emotional memories from the day and processes them in a neurochemically calm environment, low in norepinephrine, the stress chemical. This is how the brain takes the sting out of difficult experiences. It is literally an overnight therapy session. When REM sleep is cut short, which happens frequently in adults with sleep apnea, alcohol use, or certain medications, emotional regulation deteriorates. Anxiety, irritability, and low mood are not just symptoms. They are the functional result of a brain that has not had time to process and regulate. If a parent's mood has shifted, and the change is relatively recent, within the past 6 to 18 months, sleep should be evaluated before or alongside any psychiatric assessment. Ask the doctor directly, could impaired sleep quality be contributing to the mood changes we are seeing? If they dismiss the question, push back gently and ask for a referral. The navigation tip here is important. Do not frame this as, "I think you are not sleeping well." Frame it as, "I have been reading about the link between sleep and mood in older adults, and I would like to understand whether that could be a factor." Doctors respond differently when a family member comes in with information rather than just a complaint. Depression and sleep disruption exist in a bidirectional relationship. Each makes the other worse. Treating sleep alone may not be sufficient, and in some cases, treating depression first allows sleep to improve. The point is not to choose one over the other, but to make sure neither is ignored. And again, if you've been watching this far and this is connecting with something you are seeing in someone you love, please drop the number 4 in the comments. Subscribe and hit the bell. We release videos like this every week, and this community is how families find each other. Sign 5. They have stopped dreaming or say they never dream anymore. This is the sign that surprises almost every family. It sounds harmless, almost philosophical. "Oh, I just don't dream much anymore," and no one thinks anything of it. But the loss of dreaming, or more precisely, the loss of reporting vivid dreams, is one of the earliest observable signs of REM sleep suppression. And in the context of aging, suppressed REM sleep is now being actively studied as an early marker of neurodegenerative risk. Consider 2 sisters, Patricia and Joan, both 73. Patricia mentioned to her daughter casually that she had not had a vivid dream in over a year. Her daughter, who had been reading about sleep research, flagged it to Patricia's doctor. Joan said the same thing to her son, who thought nothing of it. Patricia's doctor ordered a sleep study. She was found to have REM sleep behavior disorder, a condition where the brain's normal paralysis during REM sleep breaks down. Her neurologist told her this condition, in a significant percentage of cases, precedes the development of Parkinson's or Lewy body dementia by years, sometimes a decade. And gave Patricia's family time to plan, time to begin monitoring, and time to enroll in a clinical trial for early intervention. Joan's family is just beginning to navigate a Lewy body diagnosis made 18 months later. Here's what makes this sign so important. REM sleep behavior disorder occurs when the brainstem, specifically a cluster of neurons that normally suppress physical movement during dreaming, begins to malfunction. This is not a sleep problem in isolation. It reflects changes occurring in the deeper structures of the brain that also govern movement and cognition. When someone loses the experience of dreaming
or begins acting out their dreams, talking, moving their limbs, sometimes shouting or falling out of bed during sleep, this is the brain revealing something that has not yet surfaced in a daytime neurological exam.
Ask your parents directly and gently. Do you dream much? Do you ever wake up having been moving around or feeling like you were acting something out? Ask their bed partner if they have one. If the answer raises any flags, request a referral to a sleep neurologist. A polysomnographic test, an overnight sleep study, can diagnose REM sleep behavior disorder definitively. This does not mean a diagnosis of Parkinson's or dementia is inevitable, but it is an early warning that warrants monitoring, and early monitoring creates early options. Many common medications, including antidepressants in the SSRI and SNRI class, can suppress REM sleep and reduce or eliminate dream recall. If your parents started a new medication around the same time dreaming decreased, raise that connection with their prescribing doctor. Medication-induced REM suppression is different from neurological REM sleep behavior disorder, and a sleep specialist can distinguish between the two.
Sign 6. Their sleep schedule has completely shifted. Very early to bed, very early to wake. Your parents used to stay up until 10 or 11. Now they are asleep by 7 and wide awake at 3 or 4 in the morning. They sit in the dark, watch television, wait for the house to come alive. And by mid-afternoon, they are exhausted again. This is called advanced sleep phase syndrome. And while it is more common with age, when it appears suddenly or progresses rapidly, it is often a sign of a shifting circadian rhythm, which in older adults is directly connected to brain health. Think of Frank and Lewis, both 79, both experiencing this dramatic shift in sleep timing over a period of about 8 months. Frank's family assumed it was just how older people sleep. Lewis's son mentioned it at a routine appointment. Lewis's physician recognized it as significant circadian disruption and referred him to a geriatric specialist. Lewis was found to have early-stage vascular cognitive impairment. With appropriate management, light therapy, medication review, structured activity timing, his rate of decline has been significantly slowed. Frank presented to a neurologist 14 months later with moderate cognitive decline. The body's internal clock, the circadian rhythm, is governed by a tiny structure in the brain called the suprachiasmatic nucleus. As we age, this structure becomes less sensitive to the light signals that keep our internal clock synchronized with the outside world. The result is a gradual drift toward earlier sleep and earlier waking. But when this drift happens rapidly, over months rather than years, it often signals that the neurons governing the circadian clock are deteriorating more quickly than expected. This same neurological system is deeply interconnected with the dopaminergic and cholinergic pathways affected in Parkinson's disease and Alzheimer's disease. Light is the most powerful intervention available for circadian disruption. Structured morning light exposure, ideally outdoors for 20 to 30 minutes within an hour of waking, helps recalibrate the internal clock. Light therapy boxes are available without a prescription and are effective when used consistently. Talk to your doctor about whether a formal circadian assessment or referral to a sleep specialist is appropriate. Ask specifically about melatonin timing. Not high-dose melatonin, but low-dose melatonin at the right time, which is very different from what most people use. Rapid circadian shifts can also be triggered by social isolation, reduced physical activity, or loss of structured daily routine, all of which are common after retirement, widowhood, or a move to a new living situation. Before assuming a neurological, if you have been watching this for a parent or a loved one rather than for yourself, this section is specifically for you. You are probably watching because something feels off. Maybe you cannot name it yet. Maybe it's just a feeling you get when you visit, or a worry that shows up at 3 in the morning on your own time. Here's what I want you to take away from this video. You do not need to diagnose anything. You are not expected to know the difference between sleep apnea and REM sleep behavior disorder. That's not your job. Your job is to notice. Write it down,
bring it to the appointment. Here's how to do that without it becoming a confrontation. Don't say, "I'm worried about how you are sleeping." Say, "I've been reading about how sleep affects health as we age, and I realize I don't actually know much about how you sleep. Can we talk about it?" Most parents respond better to curiosity than to concern. At the appointment, sit in if you're allowed. If your parent says everything is fine, you can say, calmly, without overriding them, "I've noticed a few things I wanted to mention just to make sure we're not missing anything." Then mention the specific signs. The doctor may follow up, they may not, but you will have said it, and it will be in the record. The other thing I want you to know is this. The fact that you are here, watching this, learning this, taking time to understand what is happening for someone you love, that matters. It may matter more than anything else you do this week. Keep noticing, keep showing up.